Hello, and welcome to this podcast on Alzheimer's awareness. These are the topics that we will be covering in this podcast. First is to look at what exactly Alzheimer's is, what dementia is and how the conditions are linked, some treatment options, a few statistics around the topic. Then we're going to explore the different types of dementia, workplace factors that can both increase and decrease the risk of dementia, prevention, and finally some support links at the end. So firstly, we're going to look at the definition of Alzheimer's to understand what this means. The Alzheimer's Society defines Alzheimer's as a physical illness which damages a person's brain. This eventually causes dementia affecting memory and thinking. They also say that Alzheimer's is a progressive condition and it's the most common cause of dementia in the UK, which we're going to explore throughout this podcast. Now that we know that Alzheimer's causes dementia, it's important to also understand what this condition is in more detail. Dementia is a syndrome of long-term problems with memory functioning, it's progressive, and it causes mental function to decline, which can then affect someone's daily living. And Alzheimer's UK say that as of 2025, approximately 982,000 people are living with this condition in the UK. Dementia can cause problems with a number of different brain functions, such as short and long-term memory, having trouble thinking and solving problems, taking longer to learn new things, trouble with language and feeling disorientated, and finally, they can really struggle with feelings of judgment and general behaviour changes. Next, we have some treatment options that people might be given. Unfortunately, neither Alzheimer's or dementia can be cured, but there are some things that can be done to manage symptoms. Firstly is cognitive stimulation, and there are various different programs for this, and it can be really great for improving problem solving and memory skills. They're also good for socialisation, as they're generally group sessions with other people who are experiencing the same condition. Then there are practical aids or equipment, and even small things can make a huge difference to someone's quality of life. For example, Alzheimer's Society lists some equipment to help with memory, household tasks, washing, bathing and using the toilet, walking and moving, and eating and drinking. Some of the things that they list are whiteboards for reminders and lists, compartmentalised pill boxes to split medication up into specific days, a kettle tipper to help pour hot water safely, timers for cooking food, non-slip rubber gloves, grab rails or bath steps to ensure safety when using the shower or the bath, safety plugs to avoid overfilling the bath, wheelchairs, walking sticks, height adjustable beds, non-slip cups and one-way straws. Make use of the support that is out there, and this can be for both those who are suffering from Alzheimer's or dementia and those supporting someone through this journey. There are a number of different charities and resources that can be really helpful, and we've listed some of these at the end of this podcast. Finally, it is possible for someone to be prescribed medication for some symptoms. However, this is up to the individual's doctor and is on a case-by-case basis. Then we have a few statistics that are UK specific to get an idea of the bigger picture around this topic. The first stat is that dementia affects roughly 7.1% of those who are over 65 years old in the UK, which in perspective is quite a large chunk of the age group. 1 in 20 cases are in those under 65, and after diagnosis, on average, a person's life expectancy is between 4 to 8 years, but this is extremely dependent on the individual and of course their specific case. Building on the information we've already covered, we've established that Alzheimer's is a type of dementia, but it's not the only one. There are various other types that someone could be diagnosed with. So around 50% of dementia cases are Alzheimer's, which we know is progressive, irreversible, and doesn't have a known cause. Then there is vascular dementia, which the NHS describe as being caused by reduced blood flow to the brain, and this is the cause for approximately 25% of cases. It's common after a stroke or after multiple smaller strokes, and it is also progressive. Lewy body dementia accounts for around 10 to 15% of dementia cases, according to Dementia UK, and this type can often be mistaken for and wrongly diagnosed as Alzheimer's disease, but it's actually caused by abnormal clumps of protein that gather in the brain cells. Dementia of this kind often declines quicker than Alzheimer's, and it can cause symptoms like visual hallucinations, sleep disorders, fainting spells, and just like the other types, it is a progressive disorder. Finally, we have frontal temporal dementia, which has a much lower rate of diagnosis at less than 5% of cases, and this can also be called Pick's disease. The NHS say that this type affects the front and the sides of the brain, and although dementia is normally found mostly in people over 65, this type usually starts before that age or at a younger age, with most cases being in those aged 45 to 65 years old. Mostly this type of dementia causes inappropriate social behaviours, so acting impulsively, showing selfish traits and lacking motivation. It can also cause speech difficulties, issues with mental tasks and concentration, and memory problems. There are some factors in the workplace that can actually increase employee risk of dementia, and we're going to explore some of these now. There are some very common factors in the workplace that can actually increase a person's risk of dementia, and some of them are easily adaptable. First is social isolation, and this is more common these days with remote working, those who work nights, work shift patterns, and drive for a living. The Alzheimer's Association say that being socially isolated increases dementia risk by around 60%, which is huge, although it's unknown why this actually is. Some studies have shown it could be because people who are lonely are more likely to be drinking more alcohol, smoke more, and exercise less, which are all factors that increase risk of dementia. Stress is another factor, and mainly due to the hormone cortisol that's released when you feel stressed. And this is because it can cause problems with parts of the brain that are responsible for memory, and it can affect the immune system. Then there are disturbances to sleep and the sleep cycle. Sleep is crucial to physical and mental health, and having a disrupted cycle can be found to affect those with dementia and Alzheimer's. The proteins that build up in Alzheimer's are called amyloid proteins, and some studies have actually found that increased amyloid proteins could be associated with poor sleep. And of course, sleep is also when we consolidate memories, so it's really important to try and keep a healthy sleeping pattern and routine to avoid this. There are a few different things in more specific work environments that may increase dementia risk in employees. A few of these are lead, pesticides, aluminium, carbon disulfide, which is used in vulcanization of rubber, perfume production. It's a component of some varnishes and insecticides. Acrylamide, which is common in grouting in mines, tunnels, and in manhole sealing. Ethylene oxide is used in the production of textiles, detergents, antifreeze, and is used to sterilize heat-sensitive products like surgical gowns. Manganese is found in mining, smelting, welding, cell battery production, and farmers are at risk when using certain fungicides. And finally, toluene, which is a solvent that is found in paints and glues. Next, we have some workplace factors that can help reduce the risk of dementia. There are some really simple things employers and managers can provide that can help to reduce risks of dementia. First is to try and help employees stick to a routine and provide structure, and this helps because it promotes cognitive function. It helps to encourage emotional stability and reduce stress, all of which go on to strengthen the brain and encourage good cognitive health. Give them purpose, encouragement, and praise. This helps with improving general mental well-being, and providing cognitive stimulation is vital in strengthening brain pathways and reducing risk of cognitive decline. Then we have a couple of tips for prevention. World Health Organization released a report in 2020 that said around 14% of worldwide dementia cases could be caused by smoking. Aside from other health problems, smoking massively increases someone's dementia risk because it restricts the blood flow to the body, but in particular the brain. And the main point about smoking is that it's never too late to quit. The effects of the body happen almost immediately. Next is to keep a healthy cholesterol, blood pressure, and take the correct medication for diabetes. Each of these things increases a person's risk, and they're all things that we can manage through some easy lifestyle changes, such as a healthy diet and exercising regularly. Limiting alcohol to reduce exposure to harmful chemicals. It's recommended to consume less than 14 units of alcohol per week, which is roughly 1 glass of beer or a small glass of wine per day. Regular exercise is a really useful tool for physical and mental health, and there's thought to be a link between depression and the risk of dementia. So using exercise for mental health is a great method of prevention, and it's a great way to have social interaction, which, as we've discussed previously, can be a big risk factor for dementia. Maintain a healthy weight and use things like reading, puzzles, and learning new skills to keep the brain active. Finally, we have a couple of support links that are really useful for more information. First is Alzheimer's Society, which has an incredible amount of information on this topic, and they also provide a dementia support line service. Then we have the link to Dementia UK, which again has a whole host of different information on the topic, and they also provide a dementia helpline. And finally is the link to the NHS website. That brings us to the end of this podcast. Thank you for listening.